award recognises an organisation that has developed models of care or research which are shaping the sector. The finalists in this category are Evergreen Care Trust, Future Roots, and St Luke's Hospice. Presenting this award is Wendy Cotton, Technical Line Manager in Social Welfare at Markel UK, our wonderful headline sponsors.
It gives me great pleasure to announce this award and to also thank those who entered for their hard work and dedication. Here are a few words from the judges. Sometimes the best ideas with the biggest impact are so simple. This project is just that, an inspired idea that is improving the experience for those in their last year of life by coordinating care and support. They're supporting people to have real choice over the place of care and death. They not only support the person and their family, but they share their expertise with support services like the London Ambulance Service. They give confidence to everyone around a person at the end of their life to help them focus and support people to do the right thing. And the winner is St Luke's Hospice. Congratulations, everyone.
Well, many congratulations.
Thank you so much.
So, Charles, where is St Luke's Hospice?
Well, it's quite confusing because I think there are about 5 or 6 St Luke's Hospices around the country and we are not connected to any of them. So okay. St Luke's Hospice is based in northwest London and we serve 2 local communities in Brent and Harrow.
Ah, so it's disgraceful. I didn't know you were there because I have spent many years in northwest London. And I gather
when lockdown finishes.
Okay, I will certainly come and visit you. Now, this obviously implies that you are doing something different from many hospices. What is it that you're doing that is so different?
So I think people always associate hospices with inpatient beds and the building, but actually only a very small percentage of our work happens in the building. Most of the people we look after are at home. And being at home, they can be much more vulnerable. They haven't got doctors and nurses and therapists around them 24 hours a day. And sometimes they need help. And often the person they turn to in a crisis may well be the ambulance service. And a few years ago, we set up a 24-hour-a-day support line, helpline, manned initially only by nurses, but in the last year with nurses and medical consultants. And we provide support to any patient or healthcare professional or relative who requires advice. But the work that we presented here was where we provided that advice to the London Ambulance Service, because it may be them who get called. And we just said, London Ambulance, if you're called out and you feel that it would be helpful to get some advice in order to keep the patient at home, call us. And they have responded. They're marvelous. They are they should be winning this award, not us, because they're amazing. And what only they will do to support people through COVID and through any condition is amazing. And they rang us for help. And we were humbled, but equally by the response that we were able to change people's lives, but also to support our colleagues.
So what sort of advice do they need from you?
It's often actually giving them confidence, because for an ambulance service to be called out to somebody's house and then to leave somebody who's clearly quite sick because they have an advanced disease. They may not be imminently dying, but they're quite sick. They need the confidence to say, is it okay to do this? Is this the right medicine? Will they be okay till the morning? Will somebody from your service visit shortly or tomorrow morning? And if we can give them advice on what medicine to give, they can then have the confidence just to say, you're okay. And that means a lot, both to the staff, but also to the patients and their relatives.
Charles, you've explained that so clearly and so cogently. You've made it absolutely clear why you and the ambulance service both deserve this award. We're going to present it to you and you can ring them up, not 999, I suggest, but maybe some private contact details that you may know and tell them that you've won the award because of your wonderful work that you do with them. So congratulations, Charles, from all of us.
And can I just say one thing? This I'm collecting on behalf of my nursing colleagues who do the vast bulk of the work.
No, you mayn't say that at all, but we've heard you say it. Listen, everybody who's created this brilliant project and this innovative idea deserves this prize, and please talk about it from the rooftops so that other hospices can see and other ambulance services can profit from your example. Well done.
Thank you.
All of you. Well done. Back to Becca.